So welcome everybody to the Homeschooling Simplified channel. I am Shanna and I've got my longtime friend Karissa with us today, and she's going to kind of go over her career with us and give us some inside details. So Karissa, go ahead and tell us a little bit about yourself.
Sure, I am Karissa Hartsalla and I have been a nurse since 2012, and I've worked in a pediatric extended care or long-term care facility, basically like a nursing home, but for children. And I've worked at a hospital in Seymour, Indiana, and I currently work for a home health agency, and I take care of a little girl that is fabulous. Um, on the side, I'm married and I have 5 kiddos whom I homeschool.
Awesome, 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 awesome. Yes, our love for homeschooling. So first question that I have for you is, does your job require high school, community college, technical college, or a 4-year degree?
So it can be a little bit of both. You can have an RN after your name and have an associate's degree or a bachelor's degree, because RN means that you have taken the classes required to take the NCLEX, which is a licensing exam that you have to pass in every state that you practice in. A bachelor's degree, you're going to need that if you want to go into management. A lot of hospitals require you have a bachelor's degree, especially out of the state of Indiana. If you get onto the West Coast or the East Coast, they're going to be requiring those. And then, of course, if you want to move up and get your master's degree or your doctorate in nursing, you're going to need a bachelor's degree. And if you want to work at a magnet hospital, which is a nurse-friendly hospital, they have better pay, better working conditions for nurses. Highly recommend working for Magnet Hospital. A lot of those want you to have a bachelor's degree or a plan to get your bachelor's degree, because that's what is required by that magnet status.
Okay, awesome. And our next question would be, if someone was interested in the career of being a nurse, what classes should they take to prepare?
Sure. I would recommend take all of the math you can, all of the science you can. You're not going to need like a calculus level. I went through calculus in high school. You won't need that level of math, but any science that you can take, whether it be a natural science like math or logic, a natural science like life sciences, biology, chemistry, anatomy and physiology, genetics courses, or even social sciences, sociology, psychology. You're going to use all of that in nursing.
Awesome. Mm-hmm. And next question would be, what was your favorite classes that you took?
I was a nerd in high school and all through school, and I loved pretty much everything. I loved English. I had a great grammar teacher. Shout out to Mrs. Kerner. And she really gave me a love for grammar and literature. My high school teacher made us love lit. But my core that I loved was, of course, science. Biology I loved. Chemistry was okay. I did fine in it, but it's not as fun as those life sciences, like biology. In college, I loved a lot of the social sciences. So women's studies, I got a minor in that. Marriage and family, death and dying, psychology, sociology, all of those classes really came back around to help me later on in the human aspect of nursing.
Yes. I had Mrs. Kerner. Loved her. Does your job change often? If so, do you have to update your knowledge and skills along the way?
I would say the basic core of what you do is about the same, but how you do it is going to change a lot over the years. If you're doing a catheter in someone, the basic, get the straw in the hole is going to be the same. But yes, how that happens can be different based on different research that's done and evidence-based practice that comes out. There's always more to learn in the healthcare field. You can be an expert in one thing, but you're never going to be an expert in everything. There's constantly new research and changes. This COVID crisis is a perfect example. We have a disease that's brand new. We don't know about it. It's not even been a year yet that since it started. and there's more and more that's coming out. I just heard it the other day. People with Parkinson's, there's a lot of people with Parkinson's that had just a little bit of signs of that they had it. They hadn't even gone to the doctor yet, and they got COVID, and afterwards it was like full force. So just little things that you never think about. Of course, you always want to follow your facilities protocol. Every place that you work for is going to have a list of all the things that you're going to do, all the tasks, and exactly step by step how you want them to do it, which is nice because if you forget something, print it out, follow it. You always want to follow evidence-based practice. So the CDC guidelines, if you're in pediatrics like I am right now, following the American Pediatrics Association protocols that they put out. You always want to stay in your scope of practice. I'm a nurse, so I'm not going to go cut someone's chest open and do heart surgery on them. You have to stay within your scope of practice. Most places that you work for are going to have continuing education courses. In Indiana, the state doesn't require that. Most other states require that you have continuing education. Another great way is to read scholarly academic journals or research articles, online. Obviously, you want to look at for peer-reviewed. In nursing school, they teach you how to search for those articles, how to look at statistics and see is it a well-done study or not well done.
Wow. Mm-hmm.
Looking at news, reliable news sources for new medications, new diseases, all those kind of little things that may not seem important to you at the time, but at some point in your career, someone might ask about it. And even if you have just a base knowledge, you can help move that up the ladder and ask questions about that a little faster.
Yep. That sounds awesome.
Mm-hmm.
How many days a week do you work and how many hours about?
Sure. That is the joy of nursing. You can pretty much pick what you want to do. There are people who work weekend options. So they work Saturdays and Sundays, 12-hour shifts, and they get paid and get the benefits of a full-time job. I worked at my first facility, I worked 2 12-hour days, and then every other weekend I would work a 12-hour and an 8-hour shift. And so that was split into 3 days a week because of how the weekend fell. When I worked at the hospital, I worked 3 12s. So we got a blank schedule about 5 weeks before, and we put in the days that we wanted to work, and the manager would go through and make sure all the shifts were covered, and we had to work every third weekend there. And then right now I work for home health care, and I have worked full-time, I've worked part-time. Right now I'm more on a PRN basis. We just bought a house and moved. We just got back from a 3-week vacation with our homeschoolers out west. So the joy of nursing is you can pick your own hours.
Awesome. And what about pay? Are you hourly, salary, or commission?
You can certainly get commission sometimes places have recruiting practices where you can get a bonus of $1,000 if $5,000, whatever, if the person stays for so long. But mostly the floor nurses, so the people that are doing the bedside nursing, we get paid hourly. When you get into management and leadership, that's a salary position.
Okay. And so you're doing home health care right now versus being at the hospital. And I'm just curious, do you like it better than the hospital, or what is your preference there? I know it's kind of like on the spot there, and we got a lot of people watching this, but
yeah,
just
absolutely.
curious.
I like both. When I worked at the hospital, it was easier when my kids were really little, and I had good childcare because I would come home and sleep during the day. Or if you have school-age children and you send them to public school, then you could sleep during the day and work night shift. I really like the night shift. I felt like I got to interact with my patients better, have more meaningful interactions just because I had a little more time, most of the time, not all of the time. but I love what I do right now, working with one patient, and I get to know her very, very well, and get to know the family very well, knowing every aspect of her care, being able to spot those little subtle differences that I wouldn't pick up on if I was just working one shift with a patient and then they were leaving the hospital, or the next night I was with a different patient. So I really enjoy both aspects. It's definitely more stressful working on the floor at a hospital versus being in a home health care environment.
Okay, yeah. If I imagine myself in that, I think I could probably agree with both of those too.
Yeah,
Very
yeah.
rewarding to be with one, though.
Mm-hmm.
And what are your hobbies outside of nursing?
I love music. I play the piano and sing. I love to listen to audiobooks and podcasts. A lot of times when I'm driving, I have my headphones in, and the kids will be doing whatever they're doing in the back, and I'm not even paying attention. I like listening to audiobooks. I usually listen to them at least at double speed, and that drives my husband nuts. I always have to have headphones in. He's like, that just sounds like they're talking so fast.
Oh, wow.
Yeah. And then my husband, my family, and we love traveling.
I love audiobooks. I think we share a love of Adventures in Odyssey.
Yes.
In that aspect, we listen to a lot of that, but I do not listen to any audiobooks that I do listen to. I just listen to normal speed. It's very relaxing. So, and why did you choose the career of nursing?
I have always known that I wanted to be in the healthcare field from the time I was really little. One of my first memories, before I was 5 years old, my sister was a baby, so I was maybe between the ages of 2 and 3, was my mom had a window fall on her and cut her leg. And I just remember very calmly going and getting all of the supplies that she needed and helping her, bandage herself. And she was like, "How are you so calm?" And so I've just always known that this is what I want to do. I love helping people. I've always had a deep curiosity about how the human body works and different disease processes. I'm able to handle bodily fluids and smells and the physical manifestations of disease that not everyone can. If you can't stand the sight of blood or, the lower regions, the fluids that come out of those, the solids that come out of those, if you can't handle that, nursing may not be for you.
Yeah.
One of the big things too is I have the ability to kind of compartmentalize my emotions. So you can't have a panic attack when someone in front of you is needing CPR, right?
Yes, absolutely.
Yeah, absolutely. So I've always been able to remain very calm and almost have a hyper focus and clarity during a crisis. It's good that you feel those feelings, but in nursing, we kind of have to put those aside during the emergency or during your shift, and then feel those feelings later and have your little mental mini breakdown later on. I've always been able to have empathy for people without going into sympathy. So sympathy is, "I'm so sorry. I feel bad for you."
Oh, yes.
And empathy is, "I can imagine myself in your shoes and I can imagine how that feels. But I'm not going to get my emotions involved to the point where I can't take care of you and I can't lose clarity of the situation in the big picture." I think that's it for that one.
Yeah, I very much agree with your personalities like that. Yes, yes. And I agree that nursing fits you very well as a homeschool mom.
Yes.
Does your job seem to excite you? And did you see yourself doing this job? I think we kind of covered this when you were little, so you did. And does your job excite you? I know a lot of us were like, "Oh, I love my job, but it's a job." So
Yeah, I think we all feel that way sometimes, but in general, I love my job. I do find it very exciting. I love that there's always more to learn. even in my job as a home health care nurse right now, and seeing the same patient every day that I work, and knowing her, I've been with her for almost like 2 years now. But there's still stuff I'm always learning. And I love that because that stops you from being bored
Yeah.
in your job. And it keeps that mental stimulation that you want in a job.
I agree with that.
Mm-hmm.
The repetitive is good, but sometimes, yeah, challenging yourself, something new.
Yeah.
Do you think there are a lot of openings in your career field right now? And if not so now, do you think there will be more in the future?
Yes, I absolutely do. Um, of course, there's always going to be people that are sick, and there's always going to be people that are well, and nurses take care of both. Um, as the baby boomer generation ages and as the setting of healthcare continues to shift from a hospital to outpatient and home care, nurses are just going to be more and more needed.
Yes, yes. Now, I know that we've covered a little bit as we've went along here, but can you give me pros and cons that maybe we haven't mentioned or talked about quite yet?
Absolutely. A pro I have is job satisfaction. I've been very lucky to have great experiences in the places that I've worked. My cat's coming up. Um, there is, of course, competitive pay. There's some people that go into nursing just for the pay. Don't do that. When you're covered in things, and people are yelling at you, the pay isn't going to be worth it. You have to have a heart for people. I love the flexible scheduling. Like I said before, I love that there's always more to learn. And one of the things people don't think about in nursing is you have an immense ability to change careers within the nursing field. So I made a list of just a few of the things that you can do within nursing or with your nursing degree. Of course, you can do bedside nursing. Everyone thinks about that. You can do management and leadership, whether it be managing a floor, managing a home health care organization, business. There are nurses that have started their own businesses to do that. You could be a chief nursing officer. So within a hospital structure, you are one of the top, 3 to 4 people within that organization. You can do research in nursing. You can be an educator, so you can teach at the college level. You have to have a master's degree to do that, of course. But you can also further your education. You can become a clinical nurse specialist, which is a nurse that gets a master's degree to specialize in one particular specialty, for lack of a better word. A nurse practitioner, there's all different kinds of nurse practitioners: pediatrics, geriatrics, primary care, women's nurse practitioner. There's certified nurse midwives, which I've used to deliver all of my babies at home. You can get your DNP, which is your doctorate in nursing practice. You can be a nurse anesthetist, I can't ever say that, which is basically an anesthesiologist at a nursing level. You do the same job as an anesthesiologist. You can work within a specialty as a nurse, whether it be surgery. Out, please, go tell your father.
Edit.
Sorry, I already said that. You can work within a specialty as a nurse, such as surgery or dermatology, pediatrics. You can be a legal nurse. You can work within the law. You can do consultation work. You can work for an insurance company. You can do travel nursing, which I would love to do at one point. You can work for home health care like I do right now. You can work in primary care, which is a doctor's office. You can do public health nursing. Public health nursing has gotten a lot of good, hopefully good press over the last few months for COVID. We're the ones that are calling you and saying, you tested positive for COVID. Let's talk about what that means, and let's talk about quarantining, and is there anyone that you've been in close contact with that we can call and let them know that they might want to get tested for corona. Those are just a few things that you can do within the scope of nursing. So pretty much any job that you can think of, You can be a computer specialist within nursing. There's so many things to do.
Yeah. Oh, yeah. Some of those you just mentioned, I'm like, oh, yeah, I never thought of that. Oh,
Yeah,
goodness, what is that?
right.
There's so much out there. So, yeah, so the knowledge could definitely be broad in where you could find a job or a career and grow. Um,
Yes, absolutely.
so, as our last question today, I just want to ask you, do you have any encouragement for those that might be seeking a nursing position that, are in our homeschool group that's thinking about being a nurse and how they can pursue that?
Sure. Like I said before, I want you to do it for the right reason. So do it because you care about people. Most of the time, people go to nursing school, especially out of high school. It's because of that. Um, I would encourage you when you're in high school, get some experience. So volunteer or intern at a healthcare facility. I was a candy striper at the hospital that I later worked at as a nurse, and just the act of pushing people around, transporting patients as that junior in high school or between those years gave me a lot of good experience. You could work as a certified nursing assistant. There's a lot of a need for those, and that really gets you in the down and dirty of knowing what nursing is. Everything that a certified nursing assistant does is included in the scope of practice of nursing. So some people think, well, when I'm a nurse, I won't have to, wipe the tails of the little old ladies, and I won't have to make the beds or give the bed baths. Yes, you will. That is wonderful for you. You need to do those things. When you give a bed bath, you are looking at the skin on the entire body of your patient. And there's been many times I've found, skin tears on a patient that hadn't been documented yet because I was giving them a bed bath. Make sure you can handle the physical, mental, and emotional aspects of healthcare, and make sure that you enjoy it. If you can do the job, but you don't like it and it's a drudgery to go to work, find whatever makes your heart, go beat. um, and lastly, I would apply for scholarships. I would work and save money so that you can graduate college debt free. If you need to take a gap year and do that, then do it. It's a great way to save up money and work within that field and make sure it's what you want to do. In nursing school, I had a friend. Her name was Nellie, and she was from Africa. And she said in her culture that they are not allowed to go to college until they're 25. They have to work within the field that they want to major in, and they have to
Wow.
save money so that they don't go to college and waste all of that money and all of that time. There's people that get to their senior year of college and they have 3 years under their belt and they decide to change their major. And you can use some of those classes, but think of all the money and time that you've wasted. And even if your parents are paying for that, that's still their money. You don't want to do that. Um, you can also work for a healthcare company that will pay for your degree. There was a lot of people in my nursing class that did that. They had started out just working as a CNA or as a secretary on a medical floor, and the healthcare company that they worked for had a program to pay for their nursing school as if they would work there for so many years after they graduated. And that's a great way to get your education for free. Nursing school is one of the hardest bachelor's degrees. You have to learn a little bit about a lot of people. And when you get out of nursing school, it's just begun. They've taught you in nursing school how not to kill people, literally. How to be safe and not to kill people. But when you get on the job, you're going to start a whole new thing. A lot of places have a minimum of 6 weeks of training, and a lot of places have a minimum of 3 months because there's so much to learn. You can do it. Nursing school is very hard, but if you're trying your best, and you're studying hard from the very beginning of your college years, and I would even say from the very beginning of your high school years, you can do it. The anatomy that I took in high school, the chemistry and the biology that I took in high school really helped me when I was taking those courses in high school. And your patients will thank you for it later.
Yes, yes, yes. I think our young people need the encouragement to know that there are people out there that even if it's not easy, you are backed. You can do this and don't give
Yes.
up. Just, keep trying, keep studying. A big thing that we say here around the house that I actually picked up from my mentor who kept telling me, and he later told me his mentor told him, is always to prepare yourself,
Yes.
always to learn because you're preparing for that future.
Yes.
And you're going to carry that with you. So even when you don't think you might not need it, just go ahead, study, go ahead and, be curious,
Yeah,
find out,
absolutely.
ask
Like
questions.
I said, about the social sciences, you may not think that sociology or women's study were important, but you get into nursing and you find that you're dealing with very stressed people. People that are sick are very stressed. Their families are very stressed. And having a basis of psychology and how the brain works, and I said I took a death and dying class, knowing the stages of grief, that's so helpful, and having the right response and being able to educate your patients is just so important. It
Yeah.
all comes together. Everything you learned comes full circle. They call nursing the art of nursing because you have that mental aspect where you just need to know the knowledge, but you also have the human side where you have to know when to just listen and when to offer advice, when someone needs a word of encouragement, or when someone needs a little push in the right direction.
Yeah. Yeah. You meet all those. You're fantastic. I thank you for being with us today. If any of you have any further questions that you might have, I'm sure Karissa would love to answer those. Just post them or reach out to one of us, or you can reach out to me and I'll make sure she gets that so that you guys can get connected. So thank you for joining us today. Thank you, Karissa. I really appreciate it. Thank you, guys.
Thanks.